Welcome to the Dr. Huber Show. Whether you're a patient trying to take ownership of your health or a physician who wants to lead with excellence, this show is for you. Each episode will dive into the heart of what matters most, strengthening the patient-physician relationship, cutting through the noise of modern wellness culture, and advocating for better systems, better standards, and better care. Your host, Dr. Trevor Huber, is a board-certified primary care physician and advocate for modern, patient-centered medicine. This podcast is meant to rebuild trust between patients and providers. Let's dive in.
We're on our way back home from TexMed 25. We're down in San Antonio for the week. And one of the reoccurring themes for the entire conference was the patient-physician relationship. That is the key relationship and the key pillar of our entire healthcare system. It always has been. It's sacred. The relationship that patient and that physician have. And now it's not just inside the exam room, it extends outside the exam room. That's whenever it becomes a very personal relationship. That's why I like saying as primary care physicians, we're really personal physicians. We're your personal care physician. I think that's a better title for PCP, is being your personal doctor. And that patient-physician relationship, man, it's kind of under attack. It's under attack from a lot of different places. And that's what we're trying to really hold sacred and prevent from being deteriorated and ruined. We feel like a lot of the insurance companies and the pharmaceutical companies and even some of the pharmacy companies, that they are tearing apart the patient-physician relationship with all of these prior authorizations, and we want to get you the best medications possible. But the insurance companies put a lot of roadblocks in front of that. And the topic of the patient-physician relationship is at the core of everything that we fight at TexMed and Texas Medical Association and the American Medical Association. It really comes from not just the doctors and what's best for the doctors, but really it also is what's best for the patients too. So that's what we're always talking about when we're in these meetings. I want patients to understand, when we're all meeting together, we would rather actually be at our offices taking care of you. We'd rather be with our families, hanging out with them. But we're coming together because we all value that patient-physician relationship, and we want to advocate for that relationship. That is the core of healthcare. And one of the big ways that we do that is by trying to come together to speak with one voice, so that we can go to the insurance companies and have power advocating for you. That's how you go to the pharmacy and that medication that you're wanting, that you're needing, that you and I have already discussed, that's how it's paid for. I think over the past 20 years, when we've had a monopoly of medicine that's happened, we've got these massive groups, and we've got these hospital-based systems, and we've got these private equity and public equity-based systems, and now we have insurance companies that own doctors, and they all kind of have their own perverse financial incentive for trying to make money off of that patient-physician relationship. And that should not be the motivation. The motivation should be to provide the best health care that you would want for your own family members. Because that personal relationship means that I want the best for you. When you're a patient of mine, I want the absolute best for you. And I'm willing to have the hard, loving conversations with you. And I'm willing to work really hard to make sure that you do get that surgery that you need, and that you do get that diagnostic test that you need. That's what's crazy. When a doctor works for an insurance company, regardless of whatever subsidiary that it's kind of falling underneath, it's all coming back to the top of that insurance company's publicly traded stock, and they're trying to control the cost of care, and they're trying to provide adequate enough care at as low of a cost as possible. Well, that doesn't sound motivating at all to a patient or physician. Nobody wants to sign up for that. I don't want adequate health care. I want excellent health care. I want the best health care. And yeah, I don't want to pay an arm and a leg for it. And there are so many regulations and laws and bureaucracies that artificially inflate the cost of health care. One of the topics that we talked about at TexMed this year was about PBMs and how they artificially inflate the cost of healthcare. The insurance companies do the exact same thing. Heck, the insurance companies own most of the PBMs. The largest PBMs are owned by the insurance companies. And then the PBMs now have offshore holding companies that are these mysterious companies where money funnels into. You know, the cost of healthcare, only about 15% of the cost of healthcare is physician services. Of all the costs of healthcare that patients and employers pay, only 15% is doctors. So that tells you the cost of care in this country is very expensive. It's too expensive. It's not because the doctors are charging too much. It's because all of these other prescription benefits managers and insurance companies, and yes, even some hospital systems, they're all artificially inflating this. And it's eroding that patient-physician relationship. So we're kind of wanting a revolution to happen. I saw that generation of medicine practice. I didn't like it. My dad was in it for 30 years. And I saw how it was in the 80s and 90s whenever it was a pretty fantastic time to practice medicine. And in the late 90s, how the physicians started having more and more barriers in between their relationship with their patients, and the patients had more barriers between their relationship with their physician. So that's what I'm hoping to help lead inside of healthcare, is a revolution of the patient-physician relationship, a reawakening of the patient-physician relationship. We need seats at the table again. Those seats have been pried away from us over the past 30 years. Most medical decision-making tables do not have a patient and physician sitting at it. And if they are, they're one of a dozen seats. They're not the majority of the seats. That patient-physician relationship should always be a majority of the seats. And we've got to come together in very unique and creative ways to take those seats back, because we're the ones that should be owning those seats. And we should be partnering with the other seats at the table to help us thrive. But we're the core. We're the ones that do all the work, and we're the ones that need those seats at the table. So I'm excited for what's coming up in the future, because I see a revival of the patient-physician relationship coming. And I've got all sorts of different ideas about how we do that from an organizational standpoint that I'm excited to roll out over the next few years. And I know after this weekend, talking to a lot of different docs at TexMed 25 and a lot of different groups, man, they're ready for something new as well. They're done with the hamster wheel of what healthcare has been over the past 30 years. They're looking for a brighter future. That's why organized medicine in the state of Texas is continuing to grow, because it doesn't really matter whether you're self-employed, part of a group, employed by a hospital, or if you're one of the doctors that's employed by one of the insurance companies. You really just want to provide excellent healthcare to your patients, and you want organizations that support that and value that and value you for providing that. And that's what we're all trying to come together to do. And that's why you see organized medicine growing in the state of Texas. And it's going to continue to grow. And we're going to create new organizations together. Physicians and patients are going to create these organizations together to put us back at the seat, back at the table, that decision-making seat. That's where we belong. It's where we deserve to be. And that's what's exciting to be happening in the future. We're taking back the heart of medicine. We're leading out our industry with the patient-physician relationship in the forefront. It's going to be a lot of changes, and change is always scary. But continuing to do what we're doing right now, that's the definition of insanity. So together, let's go to work. The patient, the physicians coming together, that sacred relationship. Let's get to doing the great work that God's called us to do, so that everybody feels like they're getting the best in medicine, and they're getting the best for their families, and they're living long lives that they enjoy. It's time to go to work.